are some things that somebody might be able to do, a caregiver might need to do, to kind of decrease that risk of skin issues in those bony prominent areas?
Right.
What could a family caregiver do to help decrease that risk?
Right. So one of the things, the first thing is what we're talking about, or one of the things is the repositioning, making sure that we're repositioning every 2 hours.
Okay.
The other thing is padding. Padding with towel rolls or pillows or things like that.
Just things like a pillow from around the house. It
Yes.
doesn't have to be any special.
It doesn't have to be
kind of
special.
wedge or anything like that.
Right. Now, if you have somebody that's sitting in a chair and has a tendency to have some breakdown on their tailbones, something like that, you may want to look into a seat cushion. And depending on the person and the pressure, some of those can be prescribed. They can do what they're called pressure mapping, especially if somebody's sitting in a wheelchair for a long period of time.
And where would somebody find that out? Where could you get pressure mapping?
You can do that. So any company, any medical supply company that specializes in special chairs or the wheelchairs, things like that. A lot of individuals that may have a spinal cord injury. Those types of cushions are very important. Some are air filled. Some have memory foam and different layers of gels and things like that. But yeah, that's very important for sitting. For people laying down, especially on your side, thinking about, trying to protect the inside of the knees and the inside of the ankles, you can put a pillow between their knees. You can, if they're laying on their back, you want to make sure those heels are up off of the bed. You don't want your heels laying flat on the bed because they're very prone to break down. So you just take, you can take a small towel roll, something like that, just to get the heels up off the bed.
Off the bed, okay.
Sometimes in a chair, I've padded people's elbows, like at the end of their elbows.
Oh, where they rest on the armrest.
Where they rest on the armrest can sometimes do that. So I've rolled up little towels and positioned that at the forearm so that area is floating, basically, and not touching a surface.